were inspired by my mom. She always pushed us to go and help people, even though when we are lacking of everything, she was always help people. So she taught us to always, if you have something, you need to share what you have, even though if it's a little.
Because we were very poor when we were kids, we cannot help like a bunch, but we can help a little bit, even with our time. So we donate our time to other organizations, and that's the way we start to learning how to helping other people. So it is a family situation, this program.
And I think that was the idea when we grew up. We grew up with that idea to share and help as many people we can. Hands for America, it's the heart of a family who wants to be a channel of blessing for many, many people in communities that they need.
Right now we're at a health clinic in the town of Agua Dulce, and we prepared a presentation for the people about HIV and AIDS and what it is, and gave them some background knowledge of how it's transmitted, how the infection occurs, and what happens once you get the disease. My name's Amy Yu, and I'm from Michigan, and I go to the University of Michigan. Back home, we are always constantly flooded with information about diseases that are going on, viruses and prevention, vaccinations. And here a lot of people just don't have that basic education. We're hoping to learn a lot about the different healthcare systems because this is a lot different than America. Volunteers are obviously students who will feel comfortable traveling somewhere and being in a culture and environment that may be a little bit uncomfortable at first, but something they are willing to adjust to. And there's a lot of challenges, obviously, such as language barriers, culture barriers, but working around those just to do a good job and present yourself in a good way.
As you notice in those communities, like kids don't have a lot of fun. They don't have toys. So that's what we decided to start doing a day for the kids.
We came out here just to bring love and spread gifts and, you know, just hang out with the kids and entertain them with candy and piñatas. Colin and I, another participant, came around the back, and a lot of the kids had a couple soccer balls, or they were all playing soccer back here. It wasn't much of an organized game, but we came out and kicked the ball around on the field, and I kind of really thought the lack of communication barrier was going to be there, but it really wasn't. All the kids, you know, had the universal smile, and everybody had a great time.
This is a typical wooden stove right here. The saddest part about this, it's, as you can see, all this goes to your lung. So this is what is causing the people the biggest or the majority of the problem, because they don't smoke, but it seems like they've been smoking because of this. This is a normal or typical bed for families here, and this is the pillow. When the weather got a little colder, they don't have nothing to cover, and the wood also will damage their bones and their ligaments and everything during the night. We're hoping for this area not to change anything, but use what they have, their own environment, to make their life better through medical service and also living situation. We're hoping to make it a better style of life. The students come here they stay here during the week to go to school, and then on the weekend they go back home, and the parents come here because there's also a project for the parents who doesn't know how to read, and they come here and learn how to read and write. This is like the capital of many communities around that are really poor and have really difficult access. We can do all of our project in this area and it will make a big impact, and nobody wants to come here, like even the government doesn't come here with help. So we fall in love with these communities because we really see the need. That's why we decided to be partners. And the majority of the communities, they don't really like the help from the government, because if they get help from the government will ask for something else. If we come here, we don't ask for anything else, just to work alongside with us in any project. They receive us very happily, because they know if we come with a project, we ask them to come and work with the group and us without expecting something from them. No.
De todos los proyectos pues, que nos ha mencionado, la parte de salud fundamental.
Basically, the health project, or like the medical service that we can provide, is the most important. He said that it's really good if we can bring like shoes and books and all this stuff, school supplies for the kids. The majority of the kids, they walk 7 hours up in the mountains with the little trails, and it'll be cool if we can bring a donation of shoes here for them, so they can be able to walk through the jungle. There's many kids with malnutrition who need really medical attention. When we bring like a medical service, we divide it into 10 per day. So that means that we can attend 800 people a day here. So it's a lot of people coming from different communities every day. The medical services are always packed up with people. Seeing a doctor, having free medicine, and also seeing a dentist. And after that, they go to be fit, because standing up all day in a line waiting for medicine or waiting to see a doctor, they got hunger, they got dehydrated. So we usually get a staff of local ladies to cook. So after they finish, they go and get food. She would like to help her own community because she knows there's a lot of need in her community.
I can't speak good enough about what Pedro and William are doing with Hands for Americas. It's unbelievable that they're out here doing this and just helping kids and families and healthcare and anything they can get their hands on.
They've been wonderful, and I would love to do anything with them again.
They've accepted us with wide open arms. I had no idea coming into it who we were going to be exactly staying with or how we were going to be handled, but they have both been above and beyond my expectations.
It's true that they put us first, and they want us to experience the country and the people, or the dynamic here, as it really is.
They've been great hosts. Like, I love them to death. I would definitely do it again. They know how to keep you safe. You feel safe with them.
When we first got here, I barely met them, but I feel like they're family. I trust them with my life, and that is really surprising to me.
They're very connected to the people, whether they know them or not, and that's something to really make us as volunteers feel comfortable with, because then we're willing to go out into the community right behind them. And when you have great leaders, it really is great to then go back and tell friends and family, like, this is something you can do, and I know that you'll be in great hands.